In this video, we briefly describe the case report and case series. Case reports and case series are among the most common types of studies published in the medical literature, accounting for over 1/3 of all articles. Case reports are descriptions of an individual patient. Case reports document unusual and rare medical occurrences and often represent the first instances in the identification of new disease entities. On the other hand, case series are collections of individual case reports. While both case reports and case series are very useful for generating hypotheses, they can't be used to test for valid statistical associations. One of the limitations of case reports is that they are based on the experience of only one person or one institution. The description of any risk factors may be simply coincidental. Although case series are frequently large enough to permit the quantification of exposures, the interpretability is limited due to the lack of an appropriate control or comparison group. In the introduction, it is important to provide the reader with sufficient background and clinical context for the case, including a brief discussion of any previous reports that may exist. Next, readers should be provided with a description of the case, which includes details regarding the patient's medical history, including age, height, weight, chief complaint, the history of present illness, details regarding the past medical history and review of systems, information about the family medical history, any childhood diseases, details regarding social history, any regular or acute medications that the patient may have received, allergy history, and, as appropriate, information regarding the patient's sexual history and or obstetric gynecological history. The reader should be provided with information regarding any diagnostic workup and or testing that the patient may have undergone, including information regarding radiologic examinations and blood work. Information should be provided regarding treatment that the patient may have received, including doses and timing of medication, any surgical interventions that the patient may have received. Lastly, information regarding outcomes and progress of the patient should be provided. In the next component of a case report, a discussion should be provided to the reader that includes a brief summary of the main findings and a review and synthesis of the literature and existing body of knowledge. The case report should conclude with a succinct summary of the case and any recommendations that may be appropriate. Lastly, in the case report, the reader should be provided with references to previous case reports or case series that may be helpful for placing the current case report in an appropriate context. We hope that this short video is helpful in providing you with a brief summary of the case report and case series.